Hello, everyone. It's your girl, Gabrielle. Welcome to a brand new episode of Hot Topics. Let me tell you what this show is about. So, this is the show where we like to have real talk about real things. We like to talk about things in mental health, education, what else? Social services. We've done topics about homeschooling, living with learning disabilities, all that mushy gushy stuff, but all with the purpose of educating you and with the purpose of you being better than how you were yesterday. So think of this as a weird twist on educational programming in a way. So the point is for you to learn something today. And today is no different. So I'm looking forward to this topic. I'm looking forward to seeing where this topic goes. So let's get right into it. So the topic today is the intersection of addiction and mental health. So I am curious to see where that topic goes. It was proposed to me. So I'm curious to see where this goes. So the intersection of addiction and mental health. So I'm looking forward to that. All right, so let me tell you who my guest today is. So my guest today, her name is Larissa Valeriano. And let me just tell you a little bit about her. So, Larissa Valeriano brings to clients a comprehensive approach to treatment. As a clinical director with a master's degree in clinical mental health counseling, me too, and an LPC associate license, Larissa's approach to solutions and outcomes is rooted in connections, vulnerability, servant leadership, and adding value to others. Beautiful. All right, so without further ado, I'm going to go ahead and bring Larissa to the stage. Hi, Larissa. How are you doing today?
Hello, I'm doing great. Thanks for having me.
Yes, of course, of course. So this was an interesting topic. It was proposed to me by your PR person, I guess. So I want to hear your take on this. So let's see where this goes. So the intersection of addiction and mental health. So I want to hear your take on that. So I'm just going to pass the baton to you.
Sure. So, a lot of the time, the way that we think of addiction or substance use is that and mental health is that they're separate. And the way that we kind of operate here at Continuum and my personal view is that substance use is a coping mechanism for an underlying mental health related issue. And so that's really the intersection. That's where they kind of intertwine there. And so here at Continuum, we treat the substance use, but also as simultaneously we're treating a mental health related issue. So treating the substance use first is more like we're getting the band-aid, but when we get into the mental health related issues, we're actually getting to the root or the core wound, so to speak.
Of course, of course. So tell us more about that. So how are the two related? How, or maybe you can give an example.
Yeah, so I can give you kind of my approach and a lot of about the other clinicians here. So the way that they're related is that for any coping mechanism, right? If they're unhealthy, we've learned that from somewhere, and we're using a coping mechanism to avoid something or mask something. So in the sense that we have a mental health related issue, we have some depression, we have some childhood experiences or even adulthood experiences that we want to avoid. We don't want to feel those intense or negative feelings, so to speak. So people tend to turn to a coping mechanism that they've either learned in the past from others in their family, or just in their environment, or they learn to use substances as a means of getting rid of this uncomfortable feeling quickly. And so that's how they're interrelated. I can go even a little bit further deeper into we talk about these inner child wounds, so to speak. When we're at a very young age, we have our basic needs that need to be met, which is our food, shelter, water. But on top of that, we have emotional needs, and those are to feel seen, to feel loved, and to feel important. And when those are not met, we start to develop these negative core beliefs, or which I call those are our core wounds. And the core wounds can really drive our thought processes about situations. They skew our perspective on things. And so that's how we start to develop the need to cope with that. So, for example, if you have a core wound or negative core belief of you didn't feel loved, so your core belief is I'm unlovable. Well, there's any situation that pokes at that wound is going to trigger a negative thought process, which is going to then lead into negative emotions, which is then going to lead into the negative behavior, which oftentimes is that negative coping mechanism of substance use.
Thank you. Thank you so much for that. So, in terms of the addiction part, I'm wondering if you can go more into that. So, what types of addictions do people turn to cope with those negative wounds?
I mean, it's really there's not one particular thing. Oftentimes here we see a lot of alcohol use, and then some of the more harder drugs. So heroin, methamphetamines. We see fentanyl coming up more often, and so a lot of the times it is the alcohol use, but it can also be the harder drugs. Some even marijuana that's used to most oftentimes to help the individual cope with anxiety.
Oh, so in terms of addiction, you focus mainly on drug addiction.
Correct.
Okay. Okay. Is it any type of drug, or is it particular drugs that you focus on?
Anything that they're coming to us with, we can typically treat, because by the time they get to us, they have been stabilized. So we're outpatient, we're intensive outpatient, but by the time they get to us, they have already been stabilized. So they, have been at least, sober for at the least like a week or a few days or so. So they're stabilized, they're able to come to us and get into the talk therapy and the group therapy. We have a residential facility that feeds into us. So a lot of times we get the clients coming from there. So again, they've gone through detox, they've gone through residential, and now they're stepping down to us. So we're intensive outpatient, which is 3 days a week for 3 hours a day.
Oh, okay. That sounds intense.
It is. It is. And so you can kind of think of treatment for this in particular as like 2 sections, whereas the acute section is more the residential side where you're getting more stabilized. They may, have medication that helps with the physical discomfort. For those without a severe alcohol use, they're being monitored because the withdrawal symptoms from alcohol use is very fatal, very severe. So they're being monitored. And then when they get to us, they're stabilized and they're ready to go. The second part of that type of treatment is the outpatient treatment, which is talk therapy, which in this case, if we're talking about dual diagnosis, addiction and mental health, then the treatment therapy is going to focus on kind of getting a relapse prevention plan. Again, that's like the Band-Aid. And then underneath that, we're getting to the root cause. What led you to that point? What is the purpose that this substance use is playing for you?
Interesting. So I'm wondering if I wanted to go back to an earlier point about the clients that are they're addicted to. I guess let's go more into the negative wound, the core wounds that you
Okay.
call it. So the core wounds basically is a need to be loved. Is that my understanding?
So yes, and it doesn't. That's not the case for everybody. What you can think of is like we have a red flag thought, an initial thought that led us to this point. But those red flag thoughts stem from something, and that is what we call the core wound or the negative core belief. These negative core beliefs are rooted so deeply in us that that's why they're called a core belief. And so typically the core beliefs stem from three categories, and that is the need to feel loved, the need to feel seen or important, and the need to feel safe. And so if we don't get those, then a lot of times, more often than not, we develop these negative core wounds. For example, if you didn't feel loved growing up, or even as a young adult, then your negative core belief may be I'm unlovable. If you didn't feel seen or heard, you may have a negative core belief of I don't matter, I'm not important. If you didn't feel safe growing up, physically or mentally or emotionally, sorry, you may develop core beliefs like people aren't safe, emotions aren't safe, relationships aren't safe, the world isn't safe. And so those core beliefs drive other different negative thoughts. So they skew your perception on events. So whereas one person may view a situation, totally fine, like let's say somebody, you got constructive criticism from a boss. Another person may be able to take that and say, okay, I need to, implement this and do this better. Whereas somebody else who, maybe was often criticized and they didn't feel seen and important, they might start to develop these different thoughts from that. Like in this situation, oh, I'm incompetent, I'm incapable, I'm not valuable, I don't matter. And then that's going to influence an emotion, and then it's going to influence a behavior. And the behavior could be, oh, I'm not going to do this anymore. I'm going to quit my job. Or what's the point in trying? I'm going to go drink, or I need to get rid of this feeling really fast, and I'm just going to go drink this, this feeling away. And so that's how it's kind of interconnected. And that's what I mean by core beliefs. They're going to be different for everybody. And they may not always be in those three categories, but the majority, they stem from those three: loved, to feel seen and important, and to feel safe.
Is it possible to have all three of those categories, or
Oh, yeah.
does it have to be one, or can it be a combination of two?
You can have all three. And that makes it even more difficult for the individual, obviously, for obvious reasons, right? But if they haven't learned to cope with that, or they haven't had the opportunity to work through that, then there's a higher risk for negative coping mechanisms or coping skills. And it doesn't always have to be addiction, but they are at higher risk for having a negative coping skill.
So what is a solution, right? So I mean, you went into it, but do you target the addiction? Do you target the mental health issue? Where do
Mm-hmm.
you start?
So typically we start by, right, we want to make sure that they have something to go home with that if they are triggered right away, they can utilize. So we typically start with a relapse prevention plan, which means, in which situations are you typically more triggered? What people, places, and things trigger you, right? Talk about different coping skills, and that could just be, putting that trial on thought, right? Telling yourself, yeah, this is really uncomfortable, but it's not unbearable. Getting into distraction, or calling a support person, getting your sponsor to be able to talk to. So we create an initial relapse prevention plan. But again, when we create the relapse prevention plan, it's a Band-Aid. So if you're only targeting the substance use, you are putting a Band-Aid over essentially a bullet hole wound. So like another example is, if you want to get rid of a tree, you don't just cut off the branches, you get it from the root. And that's kind of what we can think of that here. So underneath the Band-Aid is the core wound, and that's when we go into inner child work usually. And so that's processing or talking about, what didn't you get growing up? What didn't you hear growing up that affected you? What traumatic experiences did you have that affected you? What did you start to believe about yourself and others? What would have been healing for you to have heard? And once they can identify what would have been healing, that's the starting point. That's where we start to say, okay, well, you didn't get this growing up. This was an unmet need. And now we're going to start to reparent ourselves, because this unmet need, this core wound right now is driving this Band-Aid up above. And so while we're working on this core wound, we make sure that we at least have a bandage over, right, to keep it from, getting out of control. So we always want to make sure that they have that relapse prevention plan that they can utilize while we're opening up this wound. Right? We're asking them to go really deep into like feelings of abandonment and rejection and all of that. So we're opening up almost like a can of worms. And we want to make sure that they have something to leave with, that they can close that up if they're triggered, because chances are the conversation that they're having in therapy is uncomfortable and it's not fun, and they're going to be triggered because that's the emotions that they were coping with by using alcohol or other substances. And so that's kind of what the treatment process looks like. It's different obviously for everybody, but essentially we're giving them Band-Aid techniques, and then we're going in deeper and talking about, tell me these feelings and tell me what you didn't get and tell me what you needed at that time. And then once we get to, you identify the things that you needed, and we talk about, okay, how are we going to view this for ourselves? And then we talk about, okay, if you didn't ever get like validation, and now you're seeking validation through every, X, Y, and Z. When you don't feel validated, you turn to substances. Right? We need to learn how to be okay with being more of the person who gives us our own validation, or almost being like our own hype man, and not necessarily needing that from somebody else, because the minute you start relying on somebody else to provide you something like validation or something like happiness, you're going to set yourself up for failure, and oftentimes it can be a detrimental one. And so that's kind of the approach that we take.
Right. And it's because it's for whatever reason, they didn't get those feelings from other people. So your goal is to not necessarily find it from other people, but to find it within themselves.
Yeah. Because we always tell our clients, the only person you can control is yourself. And so you can express, day in and day out what you need from a person, but that doesn't mean that they're going to give it to you. And if they don't give it to you, then what? And so we need to be able to say, okay, I need to do this for for myself. And a lot of times when I tell people, all right, this is what this is going to look like, I often get, well, what if I don't believe that? That's okay. You don't have to believe it right away. So, right, if you needed to feel like, let me back up. I often start with by telling my clients, write a letter to your younger self, telling yourself the things that you wish you had heard. And so that could be like, for example, if I'm writing it to myself, Larissa, I am proud of you. You're a hard worker, you're capable, and there's nothing that you need to prove. Something like that, and you go on and however else, right? And then after I have clients do that, then we take a look at it and say, okay, you didn't hear I'm proud of you. So tell me all the things that now you are proud of yourself for doing, right? Because it's easier for people to write to their younger self, but it's harder for people to tell me present day why they're proud of themselves, or present day, like this positive self-talk. It's harder for them to do that. And so we talk about that in individual therapy. We talk about, you telling yourself these things. You need to tell yourself, I'm proud of you. I'm capable. I'm, doing the best that I can. And oftentimes the pushback that I get is that, well, I don't believe that. What good is that doing me if I don't believe it? And the reason why I tell clients, it doesn't matter if you don't believe it right away. You need to keep doing it every single time you have that thought of that's related to your negative core wound or core belief. Because what happens is our brains, and whether this just be, as a society, what we've, come accustomed to, but our brains are like wired to be on this negative loop, this negative self-talk loop. So it's very easy for our brains to automatically go to this negative route. And so when we're telling ourselves the positive things, what we're now doing is saying, okay, we're telling our brain that there's a different pathway that I can go down. I don't always have to go down this negative pathway. And so you're carving out another neural pathway for your brain and essentially kind of rewiring your brain. And so the more often that you can do that, it becomes easier for your brain to and automatically go down this more positive path when a situation that's, subpar, or a, an experience that negatively impacts you, it's easier for your brain to choose this positive versus this negative if you've been continuously carving out this neural pathway. So think of it as like muscle memory. And that's kind of how we get to being that for ourselves, because then our brain can automatically start going down this healthier, more positive mindset, this positive pathway. And so it just creates another door opening, so to speak, for us. And that's how we become, if we're not believing it right away, I always tell clients, stick with it, because your brain is actually doing something. You may not feel it, but your brain is actually doing something. And so eventually that's how you'll become able to be the things that you wanted, right, as a child, or tell yourself, believe the things that you wanted to hear growing up. And that's called reparenting or inner child work.
So the eventual goal is to I guess I don't know if you're getting rid of those core beliefs, but you're lessening those core beliefs, and you're increasing the positive beliefs about themselves, or helping them to increase it.
Yeah, so that there may always be a trigger that initially pops up that's like gets at that core wound a little bit. But if you're constantly able to practice and intentionally choose to choose the positive, then it's easier for your brain to say, I don't need to go. I don't need to do that. I'm gonna choose this positive route. So yes, it becomes a little less intense, because now we can say I have a choice to either, I can choose to allow my brain to go down this negative pathway, or I can choose to feed myself intentionally this positive thing. And if you've already been practicing that, chances are you're going to start to believe that. And so yes, it does kind of lessen the impact, so to speak.
So can you give some examples of ways to counter those negative beliefs? So if someone says something like, I don't feel safe, right? What would you have your client do in that situation? Or how would they counter that?
Yeah. So first of all, if they don't feel safe, I ask them, well, are you physically safe? Like, are you in danger at all? Right. If they are, obviously, we do what we need to do to get them help and get safety. But most oftentimes it's, I'm not in immediate danger, but I don't feel safe. Like, for example, relationships aren't safe, or just people aren't safe. And so what we do is we say, okay, well, can you put that thought on trial? Where's the evidence for that? And they may be able to give me X, Y, and Z. Like, this happened to me, this, and this. And okay, very valid, right? Those people were not safe. And so what a healthier thought might be is that that person was not safe. However, it does not mean that all people are unsafe. I can learn to trust my instinct so that I know who is safe, or I can choose to who I allow into my life when I feel safe, right? So it's more of a, what's a healthier thought? What's a more accurate thought? Because a lot of times we're generalizing, right? People aren't safe. That's a generalization. There are people that are safe, right? So we're not taking away or minimizing the past experience, but what we're doing is helping the brain have a more healthier, view, so to speak. So if it's, with, let's say, feeling incompetent, I'm incompetent. Well, let's put that on trial. What is the evidence for that? Well, I couldn't do this, I couldn't do that. Okay, you couldn't do it right away, but were you able to do it after you had some help? Have you ever had to do this task in the past? Was this your first time? Is this, something you've been asked to do that's newer to you? Okay, well, then the healthier thought might be that I wasn't able to do this right away, but with practice, I know that I will be successful. Or if I don't know something, I don't have to know everything. I'm not, a genius, and that's okay. I can ask for help. So it's really just kind of being nicer to yourself. What would you say to a friend in that situation? And then being able to say, I want to be my own friend, and be able to say that to myself. And so what that's called is cognitive behavioral therapy, and we do a lot of that. We do a lot of that here.
So how, because I guess let's connect it back to addiction. So does the cognitive restructuring, does that, I see that with the thought processes, but how does that help with the addiction? Because that's kind of the central idea of the show today, is there's a connection between the two. So how does the cognitive behavioral therapy help with the addiction part? How does that help someone reduce their, reduce the alcoholism, or cut it out, or turning to cocaine, turning to marijuana? How does it help the addiction part?
Yeah. So there's essentially two ways that we can think of CBT, or cognitive behavioral therapy. So if we're talking about addressing it through the core wound, right? we're addressing it through the core wound, then we know that the want or the desire or the whole reason the person's even turned to substances was because of their thought processes or their perspective of their of the situation and this negative core belief that now has driven their emotions. So remember, we talk about the core belief is a driving force. The core belief is that core wound. So because the core belief is now driving the thoughts, emotions, and behaviors, the person then started to use substances. And so when we address the very core wound, now we're almost helping them develop this more positive aspect of themselves. And so now they don't have the desire or the need to necessarily turn to the substances, because the substances was providing almost like a self-medicating, or providing like this avoidance, this wanting to mask it. And so we're no longer masking it because we've brought it to life, we've talked about it, we've worked through it, and now we have a more healthier thinking pattern. So that's one way. The other way is if we're only going to talk about substance use and talk about how CBT can just, let's say we don't even go into the mental health portion of it, we tend to go, because sometimes people do come to us and they really can't identify the mental health part, and that's okay. So we meet them where they're at. So if it's strictly, I just, want to get through the substance use, and we talk about CBT, cognitive behavioral therapy, then we go and talk about, okay, what is your red flag thought? Meaning, what do you tend to think about right before you have that craving or that urge? What is that thought process? And a lot of times it's this this craving is unbearable. Like, okay, so put that on trial. Is it unbearable or is it uncomfortable? Have you ever been uncomfortable and been okay? So the healthier thought is, this feeling is uncomfortable, but it's not unbearable, and I can work through it. So that's part of the CBT process. And then on top of that, they can utilize other things like calling their sponsor or doing distraction. But CBT helps a lot, because if they're able to talk themselves through it, chances are they don't need to rely on external things or other individuals to help them with that.
So if they address the underlying thoughts before they, I don't know, take that drink, for example, right? Or like I mean with alcoholism, like, a lot of people turn to alcoholism to feel numb, right? To not feel, to not think. So
Right.
it's when you go after those thoughts, like what are those things are you trying to mask, or what are those feelings that you're trying to hide? You bring those to the surface, and then you start putting those feelings on trial.
Yeah, we start getting to that, like, what was the driving force? What happened? What are you telling yourself about this? What are you telling yourself about yourself? That makes you want to drink. And if you can get to that, then we don't always have to specifically rely on like what I call the Band-Aid, right? Because you went to the core wound, and you worked through that and healed yourself, or as much as we can. And so, yes, to answer your question.
So when you say Band-Aids, is it just like going cold turkey, for example, is a Band-Aid solution, because they could just find another substance?
Yeah. So when you can do cold turkey, right? But what we typically tell our clients is like, that's kind of like white knuckling it, or all you're doing is being sober, which is great. But have you changed everything in your environment? Have you changed your thought processes? Because if not, then you're gonna have to seclude yourself, and you're gonna have to put yourself in this little bubble because you haven't worked through triggers. You haven't worked through the triggering emotions. You haven't worked through triggering situations or triggering people. And so if you're only just saying, I just stop doing everything, and that's all that you're doing, it's gonna create a lot of difficulty and challenges for you. Some people are able to do it. Don't get me wrong, but most oftentimes there has to be an actual, so to speak, program that they're working, because when you are using substances, you are using a reward system. Your brain was getting reward. And once you stop using that, the substances, that diminishes, right? We're stopping that. And so we have to figure out different ways to do the reward system. So a lot of times people's, working their program has to do with like natural dopamine, like working out, making that as part of their schedule. And so that's why it's really important to make sure that you're not only just stopping a substance, but how are you changing your environment, and how are you changing your thought processes, and what are you doing to how are you being intentional with the things that you do, and intentional with the things that you say to yourself. So I don't know if that answered your question.
Yeah, that answers my question. Thank you. So I'm wondering about the demographics of your clients. Are they, men, women, socioeconomic status? Do you see any patterns in your clientele in terms of demographics?
We have a pretty good variety. So we also service teens. We just started that. So we can service between 13 and 17-year-old teenagers, and that's a separate adolescent program. And then our adult programs, we have men and women. My youngest is probably 19. Oldest is probably about, I don't know, maybe 65-ish. And so it's a very broad population. And so I think that just shows us that, addiction and substance use, even mental health related issues, does not discriminate, right? So I couldn't tell you one actual population, just because it doesn't discriminate. We see people coming in from, wealthy socioeconomic statuses. We see people coming in from, the lower socioeconomic status. And so I think that just really speaks to how, addiction, mental health, it doesn't discriminate. It can happen to anyone at any point in time if you're not able to address and cope, develop healthy coping skills appropriately.
What about racial backgrounds, ethnicities?
Again, we have people of all racial backgrounds, ethnicities. We have English speaking individuals, because we're not bilingual in any way here, but we do. There's not one particular racial or ethnic background particularly that we serve. It's really anybody needing help, and there's not one specific clientele, so to speak. There's not one racial or ethnic background that comes through here that is just our clientele. It's very generalized. It's very broad.
All right, awesome. And that, like you said, addiction can affect anybody of any background, of any status. So it's it doesn't favor one over the other.
Mm-mm.
All right, well, Larissa, we're going to start to wind things down. So I like to ask my guests to share any words of wisdom with our audience. So do you have any words of wisdom that you'd like to share?
Yeah, I like to add value. So I am obviously a therapist, but also what I consider a servant leader, and my words of wisdom is that you cannot add value to others if you do not value others. And so that's what I'll leave you with, is that we're in the business of adding value to other people, but first we need to make sure that we do value those people. And so I can say that me and my team, myself speaking as well, truly, truly value these people that come to us.
Awesome, awesome. Well, Larissa, thank you for coming on Hot Topics and having this discussion with me. And I hope that it resonates with a lot of people. So,
Absolutely.
um,
Thank you.
and if I will just kind of throw this out there, like if you are needing any kind of, if you know you need help, any kind of treatment, please don't be afraid to seek treatment or
Mm-hmm.
help. All right, so let's promote your organization. So your company is called Continuum Outpatient.
Continuum Outpatient Center. Mm-hmm.
Yes. So where are you located?
We're
What?
located in San Antonio, Texas.
All right. So if you need mental health services, addiction services, head on down there as well. They're on the website if you want to learn more about them. Is Continuum with two U's, outpatient.com. They're also on Instagram as Continuum with two U's, OTC. So I encourage you to reach out to them on Instagram and go to their website if you want to learn more about them and their services. Is there anything else you'd like to share about your organization?
We do offer virtual IOP, intensive outpatient, for the adults. And that's only if you're in Texas, so we're only licensed in Texas. But I did want to add that we do have the virtual option as well.
Okay, fabulous. So, there's no excuse. So if you guys happen to be in the Texas area, you can catch them in person in San Antonio, or you could also use their virtual services. So if you are in need of any kind of assistance, treatment, mental health services, reach out to them. The information is on your screen right now uh, for those of you watching this on video. But if you're listening to this on a podcast, the information is in the description. So either one way or another, the information is available to you. All right, well, Larissa, thank you. Thank you for coming on Hot Topics, and thank you for addressing this topic with us.
Absolutely. Thank you again for having me. It was a pleasure.
Awesome. All right, you guys. So we have reached the conclusion of yet another episode. Thank you for joining me on Hot Topics today. So let me just take a moment to remind you that Hot Topics is a production of my tutoring company, A Step Ahead Tutoring Services. So if you are in need of any kind of um 1 second. I just had to give a quick note to my guest here. But thank you. What was my thought? Yes. If you are needing any kind of tutoring services, you can go to our website. It is www.astepaheadtutoringservices.com. You can also check us out on multiple social media platforms. We're on Facebook, Instagram, X. Where else are we on? YouTube, Eventbrite, WhatsApp. So make sure you check us out on multiple social media platforms. We do one-on-one tutoring, test prep, college counseling. What else do we do? Editing and proofreading as well. We do in-person services for our area of New York City, but we also do virtual services as well, wherever you are in the country. So look us up if you are in need any kind of tutoring service. The website again is A Step Ahead Tutoring Services.com. All right, you guys, thank you again for joining me on Hot Topics. I look forward to you joining me on the next episode. I thank you once again, and now I am signing off. Bye, guys.